Good afternoon, everyone. And I'm going to need these notes, so we're going to really try and hang on to them, okay? Because I don't want to miss anything. So, for those of you who have not had the pleasure of meeting me at this stage, I'm Sherry Ferguson, the interim president here at St. Mary's General Hospital. And I'll talk as loud as I can over the traffic. I just want to say thank you for joining us today. This is a very important day for us. Certainly, have Pride and Pride Month, and this is the beginning of this entire month. Is something we look forward to, and we are glad that you're here to celebrate with us today. So we're going to start our Pride flag raising ceremony today with a land acknowledgement, and we gather here to do the work in support of those we care for at St. Mary's. We are reminded that we are situated on the land that is the traditional home of the Haudenosaunee, and Anishinaabe, and the Neutral people. We recognize and deeply appreciate their historic connection to this place, and we also recognize the contributions that Indigenous peoples have made in shaping and strengthening our community. We are grateful for the opportunity to meet here. We also reaffirm our collective commitment to the challenge of truth and reconciliation and making that real in our community. And with that, I want to thank everyone, all of you, for joining us today and to welcome you to this event that we're on our first Pride flag raising at St. Mary's. But this is our first Pride flag raising ceremony in which we come together as a healthcare community to acknowledge and affirm the significance of this action of raising the flag today. We're pleased that you have chosen to be a part of it. We know that there is energy, commitment, and engagement on the part of our staff to ensure inclusion in healthcare while we care for our patients. We're committed to promoting, fostering, and respecting the voices, interests, and issues of the Two-Spirit LGBTQ plus community that provide or access healthcare services at St. Mary's. And now more than ever, we need to be engaged in this work. Many have personally experienced barriers, biases, exclusion, or felt fear about not being accepted for who they are. As well, they may not have experienced their beliefs as being valued or weighted the same way as we've weighted or valued others. With that in mind, we're committed to the opportunity that lies before us to support education and awareness initiatives that move our organization in the right direction, a direction that supports equitable access to healthcare and safe places for us to provide that care. This is also about our workplace, being safe and accessible, equitable, and welcoming and inclusive. And so for all of you, that is an important message to take away today. It is an honor to be part of this important work and to share with you today the organization's commitment to this work. I would invite you to think about the possibilities that exist to improve the patient experience and to consider what it means to embrace diversity, inclusion, and to foster a safer workspace as well for our colleagues. I'm actually going to refer to my colleagues.
Good afternoon, everybody. My name is Gary Payne for St. Mary's Hospital, as well as throughout the St. Joe's Health System. The rainbow flag, which is more commonly known as the Pride flag, is a symbol of lesbian, gay, bi, trans, queer, and transparent diversity. The original Pride flag was created in California by the artist Gilbert Blake in 1978. Of that original flag that was raised almost 20 years ago. So this flag is known as the Progress Pride flag. And it was designed by a man whose name is Daniel Quasar from Portland, Oregon in 2018. It explicitly includes black, brown, and trans flag colors. In raising this flag, St. Mary's acknowledges the emphasis that there must be on including the transgender community, gender diverse communities, Black communities, Indigenous communities, and racialized communities in all of our Pride celebrations today and going forward. We acknowledge that without the trans community, without Black, brown, and racialized communities, there would not be a Pride celebration today. In raising this flag, we honor those who fought for 2S LGBTQ+ rights in the 1969 New York Stonewall riots, including Black transgender women like Marsha P. Johnson, transgender women like Sylvia Rivera, and many others. At St. Mary's, we are committed to diversity, inclusion, respect, education, and safety. And so to mark Pride this year and to celebrate the diversity of the 2S LGBTQ+ community, we raise the Pride flag today for all to see.
We want to raise Progress Pride flag, celebrating Pride. And Greta are going to recite, and Brandon. Gary and Brandon, thank you.
No, Brandon and Greta.
Brandon and Greta, we welcome you to do a self-affirmation. Thank you.
At St. Mary's Hospital, Kitchener, we believe that Two-Spirit and LGBTQ+ people have the right to health care that is free from discrimination.
Two-Spirit and LGBTQ+ people have the right to have their gender identity and expression respected.
LGBTQ+ people should feel safe sharing and expressing their gender identity.
That Two-Spirit and LGBTQ+ people have the right to be called by their chosen name and pronouns.
That Black, racialized, and Indigenous LGBTQ+ people have additional barriers to accessing healthcare. We are committed to repairing damage done by systemic racism, colonialism, homophobia, and transphobia.
And we thank you for that affirmation. And there's no question, this is a journey. It's something that we are looking at activities as well as to honor and respect the diversity within our workplace and caring for our patients. And a big shout out to our Mom Hugs group here today. You know, I think it's really important they're wearing their t-shirts so that we can as well tell the story about those of us within a diverse community who've not had the same privilege of support and love within the community. And that's what we're here for today, is making sure that that inclusivity is alive and well. And thank you for taking that message out to other communities as well. So we look forward to it.
To those of you who don't know me, I'm Winnie Doyle, the Interim President and CEO of a St. Joe's Health System. This is an important milestone and beginning across the St. Joe's Health System in formally incorporating the raising of the Pride flag in our journey to strengthen equity, diversity and inclusion. Thank you to each one of you that has participated today. We are proud to embrace each member of our human family and to honour each one with dignity and respect, and all that defines our individual uniqueness. We are on a journey to strengthen justice, inclusion, and respect in all we undertake. Happy Pride.